right, we're live. Welcome back, everybody. Thank you all for joining us for this exciting presentation by Rafael dos Santos. He's a professor at the University of Sao Paulo, Brazil, and he does some really exciting research into Ibogaine as well as Ayahuasca in the past. And I think he's going to have a really fascinating presentation. And as a scientist myself, I for sure am looking forward to this talk quite a bit. Please use the Q&A for your questions, the feed for comments. Rafael, the floor is all yours. I'll be there towards the end to moderate the questions. Enjoy.
Okay, thank you. It's a pleasure being here, and I hope you enjoyed the talk. I will share my screen now. Ibogaine and classic hallucinogens. I work in Ribeirão Preto Medical School in São Paulo, Brazil, and also in the National Institute of Science and Technology, Translational Medicine, at Cortical Serotonin 5-2A receptor. This is the definition by one of the leading experts in the area, Dr. Dave Nichols. And you can see that the structure of the indolic structure present in serotonin is also present in LSD, psilocybin, and dimethyltryptamine, or DMT. Psilocybin are present all over the world in hallucinogenic mushrooms, but they have a huge, very deep history of traditional use in Mexico. In this area, you can see on the map near the Zapotecs, but not only the Zapotecs, the Mazatecs, and several tribes still use several species of psilocybins in rituals over there. LSD is a semi-synthetic compound called deliseed by it was synthesized by Albert Hofmann and Sandoz Industries in 1938. The scientists who also isolated in 1957 and synthesized 2 years later psilocybin, that was also called indocybin by Sandoz. So these compounds, they had a huge history in psychiatry. We'll talk a little further. Ayahuasca, which contains DMT, comes from the Quechua word spirit and liana or vine. So the vine or the liana of the spirits. It's traditionally used by dozens of indigenous groups, not only in Brazil, but also in Colombia and Peru for ritual and therapeutic purposes. You can see a picture of the Caxinawa indigenous tribe in Brazil, and in Colombia, the Tucano, one of the pictures by the late, of the father of the ethnobotany, Richard Ivan Schultz. Ayahuasca is a very interesting phenomenon because in the 30s and 60s, maybe some of you have heard about Santo Daime or UDV, União Vegetal. They are really churches. You can see the images, the rituals. They are Christian rituals blended with syncretic elements of Brazilian Afro-religions as in the indigenous world. That nowadays, they have more than 2,000 users across the globe. So it's a very interesting phenomenon. In Europe, in some states in the US, they can practice the ritual use of ayahuasca. It's in pharmacology, it's very interesting because you cannot ingest the psychotropic plants and feel psychoactive effects because the DMT is degraded in the gut. They somehow discovered that by combining the vine, Banisteriopsis caapi, with these substances, you can see the three main beta-carbolines, harmine, harmaline, and tetrahydroharmine, the one that has usually more quantity, harmine and tetrahydroharmine, and DMT. They all share this indolic ring with serotonin. And after different indigenous and syncretic groups, they have different recipes for preparing ayahuasca, but basically the decoction of several hours of these plants, producing this brownish and bitter beverage. As I was explaining, nobody knows how the indigenous discovered that by mixing Banisteriopsis caapi with Psychotroph viridis or the other DMT-containing plant, Diplopteris cabrerana, it allows DMT to reach the brain in this here just a hint of the possible mechanisms that I'll talk later, maybe permitting DMT to reach the brain in these brain areas full with 5-HT2A receptors, especially the default mode network in its areas like the prefrontal cortex and the cingulate posterior cortex, for example. Ibogaine has somehow a similar way with ayahuasca developed. It was isolated in 1901 in France, and it has also a huge history of ritual medicinal uses in Gabon, Congo, and Cameroon, in the Buit rituals. There also are syncretic rituals, blending also African more elements with sometimes Christian elements. In pharmacology, Ibogaine is what we call a promiscuous drug, because unlike DMT, LSD, and psilocybin, they are like more akin to a 5-HT2A receptor. But Ibogaine, it's this promiscuous drug which seems to interact with several receptor systems as agonists or antagonists, like glutamate system, including the 5-HT2A receptors. And what we'll talk more in the end of the talk about these neuroplastic effects, that in fact it shares with Glaxus, hallucinogens, and also ketamine. Ibogaine is metabolized in the gut by these CYP proteins to noribogaine, which usually includes have a wider time in the body. Like ibogaine, less than 24 hours, it is eliminated, while noribogaine can stay in blood long up to 72 hours. Well, these substances, especially psilocybin and LSD, in the 50s and 60s, they were tested in thousands of subjects, not only healthy volunteers, but also patients, especially with mood and substance use disorders. DMT, curiously, was not a substance that was tested in this time, or was only in few trials. However, this I think that we must recognize this day, the lack of placebo control groups and follow-up assessments, as well as the non-standardized interventions, several doses of drugs, several kinds of psychotherapeutic intervention. There were limitations to the generalability of these results. In fact, we see that in this very interesting graphic. In the upper part of the graphic, psychedelic or hallucinogen research increasing up the prohibition with the Controlled Substance Act in the 70s, and then what scientists call the Psychedelic Renaissance. Some scientists say that it started in 2006, but it's wrong. It started in the early 90s with the work of scientists like Rick Strassman with DMT, Leonard with mescaline, Gozuris My Frank with psilocybin, Franz Vollenweider with psilocybin, and also the late George Riba with ayahuasca. So psychedelic renaissance really started 10 years before some people say. And we see that the research then started to reduce with the prohibition laws, but we see again, after work of Dr. Strassman, the rise again of psychedelic research with ayahuasca appearing here, mainly with the contribution of people like George Riba. So this is a meta-analysis published in 2012. Meta-analysis like a huge paper that we try to synthesize the literature on that specific topic. So what you can see here, some studies from 69 and 70 with LSD for alcoholism to maintain abstinence from alcohol. And we see that up to, we see three moments. The first follow-up here, and then a follow-up some months, a short follow-up some months later, like 2-3 months, and then a longer term follow-up of 6 months. And LSD increased the maintenance this abstinence alcohol at least for 2-3 months. So it's a very, these are some of the few randomized and placebo-controlled trials done in that time. But here enters this historic person, like Howard Lotsoff. We can see the picture of Dr. Lotsoff in this bottle. With heroin problems, when I wish to use heroin for some days or some weeks, I don't know exactly the history, but unfortunately he passed away in 2010 without seeing the moment that we can appreciate now that Ibogaine is increasing. That's why this event is happening. No? And the first case series also another argument to see that psychedelic renaissance indeed started in the early 90s. We can see the first case series by Shepard in the Netherlands with 7 opiates dependent individuals that were improved with Ibogaine. So the current studies. Now we jump to 2017, 2015, the first studies. Now we start with the observational studies with psilocybin and LSD. There are others. These are these 4 are only some four emblematic examples of some of the leading research groups in the world, especially the work from the group of led by Dr. Roland Griffiths from the Johns Hopkins University. But we have today several other groups, including our own, doing this kind of research. So we see that from these observational studies that people that in general, and many in the United States, but other countries also, who in their lifetime use hallucinogenic drugs for recreational purposes or for ritual therapeutic purposes or for self-knowledge, they report less use of other drugs like tobacco and psychostimulants and alcohol. So that has been confirmed in two open-label studies, recent open-label studies. One published in 2014 with tobacco smokers. It's the psilocybin. Two doses of psilocybin were integrated in a 15-week treatment protocol, and what you can see here is a huge, significant decrease by 8% of the participants were abstinent at 6 months follow-up. This is almost unbelievable. You cannot find that with any other treatment. So that's why we science out, that keeps us alarmed. So no, that's not. So that's open label. We have to be humble here. The effect of the substance is very clear on the mind of the subject. So we until we see the results from placebo-controlled trials, it's very interesting, it's promising, but we should keep, it's not, this study does not mean that psilocybin will cure tobacco addiction. It's preliminary, it's promising, but it's preliminary. And the same thing for alcohol dependence. It's also open label from the group of Dr. Bogenhutz in New Mexico. So we see here again, psilocybin introduced inside psychological 4 weeks and 10 weeks program, and you will see that not only the drinking days, but especially the heavy drinking days, significantly reduce 5, 8 weeks after the start of the treatment. So again, this is very interesting. This is not easy to find with other treatments, but this is open label and preliminary. This is a research I performed some days before the conference now to see clinical trials. It's a platform where scientists register studies they are conducting. Scientists are not obligated to register the studies, but they are encouraged to do so. And we can see at least 8 studies, many in the US, for alcohol, tobacco, and cocaine disorder with psilocybin, and none, at least in clinical trials, with LSD. So I really think that in the next 5 years, we will see very interesting results from randomized placebo-controlled trials with these drugs. Going back to ayahuasca, which is more my field of research, we also see that it's interesting because ayahuasca, it's indeed the hallucinogenic psychedelic compound which has more preclinical evidence that can be useful in substance use disorders. So we have included this image. We will publish it soon. An updated systematic review of the same topic where we found, here in this one, we found 10 studies, like I think 5 preclinical and 5 observational. And in the update review, 2015 onwards, we found again 10, 5 preclinical and 5 observational. So ayahuasca has at least 10 preclinical different studies showing that or ayahuasca or some of its isolated alkaloid like harmine can be useful from a therapeutic point of view in substance use disorder.